rib injuries. So rib injuries end up causing hemothorax, pneumothorax, or hemopneumothorax, both of them. So it's important to kind of get familiarize yourself with the visceral pleura and the parietal pleura. If you actually look at that, then understanding the three most common injuries that you get from rib fractures is a hemothorax, a pneumothorax, sucking chest wounds, and a flail chest. So where do the questions come from typically? Anyone who ends up having a rib injury, the first most important thing is you need to do pain control, because without pain control, patients they stop breathing. So you put them on proper pain control, and if that doesn't work, you can even do like an intercostal block. So in a hemothorax, you need to evacuate, because if you don't evacuate the blood and anything, whether it's air or fluid, you're going to do a chest tube and do an underwater seal. So if it's anything more than like 1,000 milliliters of blood, or you're collecting more than 250 mils of blood an hour, you need to evacuate, because or else it results in empyema, infection, pus, and everything, leading later on to fibrosis, and that's a problem. If it's a hemopneumothorax, when you do the chest x-ray, you'll see air fluid levels. So that's one thing. And with the sucking chest wounds, what are they? So sucking chest wounds are basically where you have punctured the lung and you're sucking air into that pleural space during inspiration, but it closes, and when you try to expire, it's not going to go out. So you just keep on building pressure inside. So that's what causes the deadly tension pneumothorax. So one way to treat that is to put an occlusive dressing that has 3 sides that are closed. So, and then you put the chest tube in, and then you're going to manage according to if surgery is needed or not. Well, that's where that question would come in, is that occlusive dressing with the 3 sides that are closed. Flail chest. So flail chest causes paradoxical breathing. So normally when we breathe, when we inspire, our chest is supposed to expand out. And then when we expire, it's supposed to collapse, and then the air, all of it comes out. But this is opposite. So when you inspire, the chest collapses, and when you expire, it opens up. So again, that's what flail chest is. And if you have ribs that are broken in multiple spots, you're at risk of all of these things. So in any of these major injuries to the lung like this, in the management, you should always be aware of how much fluid you're giving, how many colloids you're giving, because colloids actually retain more fluid. They bring more fluid, like draw more fluid towards them. And a damaged lung is very sensitive to fluids. So you should be very cautious in fluids, any other colloids you would give, diuretics you're giving, everything must be done in a balance. Okay, that's it.